Engaging patients and providers in Partnership for Prevention of Heart Disease was a really interesting and exciting project. We call it the Middlesex 4P project. And what was interesting about it is that it was really focused on empowering patients. We have lots of medicines and lots of treatments, but none of these things are very useful if patients aren't engaged and actively playing a role in managing their illness.
High blood pressure or hypertension is a major risk factor for heart disease, stroke, and kidney disease. Hypertension affects 1 in 3 American adults, and more than half of them don't have it under control. Now, this also includes people who do have medical insurance, who are taking medications, and who have seen a doctor at least twice within the past year.
The CTG grant is a CDC initiative that addresses chronic disease, and at its heart is the formation of a coalition of partners from the community to assess and address policy issues that will impact chronic disease in their community.
Managing high blood pressure in patients can be quite challenging because blood pressure varies throughout the day, and when a patient comes to the office, they're often running late, they've been having parking problems, they're stressed, and their blood pressure may be higher than what it normally would be, and it therefore means that we're making decisions in the office based on information that may not be the most accurate. So having the opportunity for patients to monitor their own blood pressure at home under normal circumstances and come to the visit with a set of readings that more accurately reflects their reality allows us to take better care of patients.
This program was different in that it recognized what we're increasingly coming to know in healthcare, and that is that primary care and healthcare in general is a team sport. No individual provider has the resources or all the skills necessary to manage every aspect of a patient's care. So the team, in this case, included nurses, primary care providers, medical assistants, and others, all working together and engaging to help patients.
I think the fact that there are no symptoms with hypertension, often as much as we try and tell our patients that it's important to monitor, having someone else go alongside them but also be a cheerleader of sorts to encourage them toward their goals was something that enabled us as providers to have the help that we need in order to give hypertension the attention it deserved.
Even the first follow-up visit, we'd see results because they check their blood pressure every day. So instead of them coming to the office, we do one blood pressure check and maybe a repeat. We'd have about 10 numbers. So being able to look at those, average those together, it was definitely more accurate. And I would say 80% of them that I saw would have a lower reading, which was great.
Motivational interviewing is the process where you elicit from the patient what their feelings really are and what they prioritize in their life as important for their health. And then you assist them to make decisions about action plans, such as eliminate the sugar beverage, or increase a walk, or add a walk or 10 minutes to their walk. Simple things that they can do that are going to help them reach their goals.
In addition to giving the patient the home blood pressure or cuff, we wanted to make sure that they had tools that they could use at home to support them in their journey. This is a booklet that we use called My Path to Healthy Numbers. We ask them to write their numbers in this book. Once they're actually writing those numbers down and they're already taught what's normal and what's abnormal, it really helps them to understand a little bit about what's a good blood pressure and where they fall.
I had people write, I ate a salty meal. You know, I had canned soup the night before. So they could correlate what they did and what their health habits were that affected their blood pressure. 9 times out of 10, they were going to choose the healthier behavior because they could see it.
They set goals, they achieved those goals, and most importantly, they improved their blood pressure. Over 75% of the patients who took part in our project showed an improvement in their blood pressure. And these weren't just any patients. These were some of the toughest patients, patients who hadn't been able to improve their blood pressure in the past. So we're really very excited to continue the approach that we took with hypertension, to expand it across the state, and to expand it to other conditions as well.
I think the Middlesex 4P program was a beautiful example of how we can engage the multidisciplinary team in providing better care to our patients.